Welcome to Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our goal is to provide a platform where we can educate, advocate, and inspire women leaders to lift as they rise. With every episode, you'll hear from her as we showcase the perspectives, insights, and experiences of women who are leading the way in advancing women's health and empowering the next generation of women in healthcare.
Welcome to the very first podcast episode of our Women in Healthcare Leadership series. My name is Yelena Sporopoulos, and I'm the Vice President of Clinical Strategy at Medscape Education. And I have the privilege today to have with me Professor Carolyn Lam, who is a consultant cardiologist and the Director of Women's Heart Health at the National Heart Center in Singapore. Welcome, Carolyn.
Thank you so much.
And I also have with me today Karina Morley, who is the Head of External Scientific Affairs at AstraZeneca. Welcome, Karina.
Thank you so much.
So, Carolyn, let's start with you. I wanted to ask you, because this is always something that's very fascinating to me, but what prompted you to enter the field of cardiology?
My mom. It's a tiger mom. But no, that's got a little bit more to it. So my mom's an incredibly capable pediatrician. And so I think...
So is mom. My mom is also an incredibly capable pediatrician. So
oh my goodness. So I literally spent my childhood growing up in her clinic, and I was asthmatic. So she taught me to deliver my own nebulizers, right? So I'd be like in her clinic doing my own thing. And I suppose I just never thought there was a more meaningful thing than to help other people through medicine. So that's how I got into medicine. But then the story of how I got into cardiology and specifically started a women's heart clinic is again, my mom, who was always just like the most capable person, healthy, the one taking care of everyone else, especially nagging my dad about his health. She collapsed in clinic one day. And basically didn't even realize that she had long QT and had collapsed. And thank God, by a miracle, she, just didn't have a full cardiac arrest. But it just scared me so much that women are not recognizing their risk of heart disease, constantly worrying about everything. It also really showed me how important women are in society and everything. And frankly, it just motivated me so much to say, all right, I got to set up a clinic. I got to study what's different about heart disease in women and men. And that here I am.
I absolutely love that story because it highlights so many things that we actually wanted to discuss today in our podcast episode, right? So, you alluded to this now. What are the current gaps then in the care that women receive in the field of cardiology? And how can we make sure that that's not the case, that women can receive equitable care?
Well, if I may start with first saying women are not even recognizing their own risk of heart disease, even though it is really the top killer. If you want to bunch all cardiovascular disease together, it's representing 1 in 3 deaths. And it's not just in the US or whatever Western ideas we have. It's all over, including in Asia. And heart disease and strokes together actually cause far more deaths than, say, breast cancer. And we're also obsessed with the breast cancer and with all the gynecological things and not going for heart screening and prevention. So that's one thing, is our own lack of recognizing our risk. But then as well, there's historical trials that were pure men trials to define risk factors for heart disease, or complete underrepresentation of women in our even current cardiology trials. So let's just put a silver lining. Thank goodness it's increasing. But, if we're not recognizing the risk, if we're not including women in the clinical trials, we're not understanding if there are differences, and it just perpetuates that way. So there are big gaps I think we need to address.
Yeah, and I want to ask Karina also about, the pharmaceutical industry and the clinical trials, because you brought up a very important point. We need to ensure that we have women represented in major trials, whether they're cardiovascular trials or really in any field, in any discipline. So, Karina, from your perspective and having worked in the pharmaceutical industry for a long time, what do you think the pharmaceutical industry can do to address this and to really help?
Yeah, I mean, I think Carla makes some great points around kind of the barriers, and we still see only 10% of lead authors on cardiovascular clinical trials are females. And I think, that's changing, but not changing at the rate that we would like to see for sure. And I think the industry absolutely can help. And there's a lot of programs in the industry and kind of mandated exec committees now, and making sure they're diverse in a lot of companies. I think, the first thing around study design, we really need to be thinking about incorporating sex specific considerations into cardiovascular trials and into inclusion criteria. We also need to make sure that we've got innovative recruitment strategies in place, such as language, recognizing that females play a big role in the community, and making sure that there's provisions made to facilitate them to turn up at a trial centre. Reimbursement's a huge opportunity for us to think about, the cost related to participation, including things like transportation and childcare costs, so that if a female is the main kind of looking after the kids, that you allow them to turn up for a clinical trial and be more flexible about how that can happen. And then, of course, without a doubt, the recruitment and retention of female trialists, equal opportunities, sponsorship, research funding, salary support, publications, and a really robust career development to increase recruitment and retention of female trialists. And I think the pharmaceutical industry and healthcare industry can certainly support a lot of those strategies to drive that.
No, absolutely. And, I can tell you that having worked in the, medical education industry, we try to ensure that this is the case, and that both, women who are investigators and potential trialists understand the scope and the importance of participating, that we give them tools and resources, but as well as patients, right? Because if patients come and they ask about clinical trial participation, and especially women, I think that's probably equally important. So can you comment on that?
Well, if I may first, I couldn't agree more with what you said. And it's so encouraging to hear you talk about it, Karina, from a leadership position in industry, because I really hope we're starting to see a change. It is so important, even from the patient participation point of view. There are data that show the more women are in leadership, or at least involved in the trial design or execution, the larger the recruitment of women in that trial. It's just been shown, it's data. So there is something about the way we can design and make intentional efforts to include women. I think a very, very important element is, when we're talking about trialists and training trialists, we're now doing better about getting women into medical schools. We're doing better about getting women to consider doing cardiology, for example, or specialties that are traditionally seen as male-dominated. But we're not seeing the same runway up to a leadership position. And why not? I really, really hope that at least in my lifetime, I see a point where it's equitable. Now, we're not saying put a woman there just because she's a woman. We do not want to be window dressing. We don't want to be there just to be a token, nor because we're the ones who can communicate but not lead, or something like that. I mean, I don't know. I've heard just a billion, frankly, excuses. But we want to be there because we are capable, or we've got the experience, or that we can add value, true scientific and leadership value to a trial, and to be given an equal chance to have diversity.
And do you think that there are barriers, specific barriers that exist today to you mentioned a runway, right, to sort of elevate women and get them into leadership role. Do you think that there are barriers today? And more importantly, how can we address those barriers?
Yeah, I mean, there are, and you mentioned one of them around, patient education. There's patient education, there's medical education, and then there's, the president, as you said, Caroline, very rightly, the presence of female trial leaders. We know that if you've got leaders, female leaders, they will be more diverse in recruitment of populations. And also, the sex differences that people don't always think about when doing an inclusion criteria. And I think that's why females don't get included, because the inclusion criteria don't necessarily go into enough detail to make sure that those females are allowed into a study. So I think there's a huge amount from A to Z around, designing the trial all the ways up to, and as Caroline said, communication is females are by far better communicators, but this isn't about recruiting someone because they're better, having a female leader because they're a better communicator. This is about how does that communication lead to a more diverse clinical trial?
And better outcomes, right, for patients,
absolutely.
Which is all of our common mission at the end of the day.
Yes, generalizability of that clinical trial to everyone, diverse. Maybe not just women and men.
Exactly.
Diversity in terms of
we were just
ethnicities
talking
and regions and so many other things. I think it's so important.
Yeah, and we did, talk earlier around diversity. We have to, make sure when we think about diversity inclusion, we're not just talking about male or female, black or white, color of skin. It has to be personalities, leaders, all of that part that makes us different and makes us inclusive of other people who are maybe not like us.
Yes.
And I think that's critical.
So, I think this is such an important discussion, but I also want to make sure that we talk about some practical tips, resources, and tools that exist currently, or maybe that they don't exist currently, but that we can think about, and one day they will exist for women who want to not just have professional careers, but advance and have leadership roles. So maybe, Karina, you can comment in terms of the pharmaceutical industry. What tools or resources currently exist, and how can we elevate women?
Yeah, I mean, I think there's skill sets. There's, skill sets that maybe women often maybe don't get put on leadership programs because they might have taken a career break for whatever reason, and they've kind of missed that boat on that year, or they're busy. And often women are so busy doing, they almost forget about themselves in a leadership position because, and of course, we've all seen those statistics where if a female looks at a job description and she can't do almost every tick box that's on the job description, she won't apply. Whereas a man, if he looks at it and he can do 20% of it, he's like, I'm in. So it's how do we get to think about not just the tick box about what a job should look like and if I've done it before, but think about I've got those skills. I may not have exactly done that, but I've got the skill set to do it. But we've seen lots of programs and especially in the pharmaceutical industry, which is my kind of area of expertise, I guess, is, we've got lots of different programs around women leaders in pharma, to empower women into the industry and then, making sure that they are put in given the same opportunities. And we see that a lot. And, there's a lot of companies now who have mandates around making sure their executive committees in leadership positions are diverse and inclusive. We've seen many programs which Caroline would be very familiar, things like Women as One and Global Cardiovascular Clinical Trials Forum, future trial fellowships, and making sure that it's not just, jobs for the boys but as Caroline said, we don't want to, just put women into positions just because you're a woman. It has to be, but there are plenty absolutely phenomenal women there that out there that we need to help. We need to help them to get there and think about those. We've also seen many of advocacy organizations, making sure that they're, like societies, making sure societies keep up as well with and getting women rather than, a whole panel. And, I know there's some of the societies out there who will insist on having, a diverse on every single panel discussion, having a diverse group of people. And they're the kind of things that can help. And us as females need to help as well, and getting new people in and being mentors for new people.
And what about in medicine, Carolyn, right? Because when we look at the statistics, there are lots of women in internal medicine, in pediatrics. In cardiology, the statistics are not quite, I think, where we'd like to see them. And then I think especially when you look at leadership roles. So, are you aware of, tools, resources, initiatives that are going on to promote and elevate women in cardiology specifically?
I just came from a incredible discussion organized by the European Society of Cardiology just to talk about this topic of, from grantors to societies, what can be done to ensure a little bit more equity. Let's put it this way. We're not trying to bias against the guys, just ensure more equity. And I think just from real life examples of what I've experienced, I felt a tremendous change, for example, and for the better, when Professor Barbara Cassidy was president, first ever president, a female president of the European Society of Cardiology. And what did she do immediately? She made sure that her leadership team included few more women than used to be there, so that there was diversity. What did she do in the first ESC Congress under her presidency? There was childcare. Simple thing. Childcare was available. And I cannot tell you on the ground how many times I've heard women say, oh, thank goodness, because now I can attend the sessions. Even if we're talking about couples, and there are many couples who are both working, and they both want to attend, and it's usually someone who has to draw the short straw to be with the kid while the other person attends. Well, guess which
welcome
way
to,
it falls
welcome to my world.
Right? And so, it's like that has made such a difference. So I think having examples and role models, having really tangible things happen, like the childcare, like grants, sort of saying, encouraging that there is representation of women in a leadership, or that there's a plan for inclusion in the grant proposal. Those things are all tangible ways, I think, of helping younger faculty rise to the top. And I really love how you ended, Karina, by saying, I think women who manage to get to the top really, really need to advocate, sponsor, help other women. And this is the part where we need to be very, very careful, because I've also unfortunately seen that we can be our worst enemies. It's been said, right, that there's a place in hell for women who kind of don't help other women, or who try to impede other women when they're in the position of leadership. So, maybe let's watch ourselves as well, that we keep the runway open and create a suction effect to help the next generation just keep getting and surpassing ourselves.
I absolutely love that. And that brings me to my very last question about, the future. So what do you think? I know it's a really hard question, but, what does the future hold? What kind of issues are women in the future going to face? And how can we set the stage for them to ensure success? So I don't know who wants to take that one first.
I mean, I think we're heading in a good trajectory. It's slow. I think we need to recognize that. But as Caroline said, putting all of these things in place, I think will absolutely help. I think, we see at the moment of the top, 500 companies, only 8.2% are still female CEOs. But that has increased, and I would hope, in the next 10 years, we would see that, tripling at least. I think that would be, a good benchmark. But we're also seeing that, in the US at the moment, in 2021, 500,000 females achieved a master's, whereas our male equivalents, there was only just over 300,000. So, the education, women being educated is not the issue. That is absolutely, so we see that even more women are getting, more degrees, etc. But it's how do we get them? And I think everyone has a role to play. And I think, you don't have to do big things to achieve that. There are some small things you can do. For instance, in hospitals, and you could have a women in leadership program in a hospital. I don't know any hospitals that run women in leadership programs. Obviously, we talked about the industry, and the industry has many programs in place across many pharma companies around women, elevating women. So it's how do we get, public services to drive that as well, and not just private companies where you're a bit futzy company, so therefore you need to achieve some benchmark stuff. It has to be everywhere. So I think there's a great opportunity. We are seeing it getting better, but I think we have some way to go.
As I'm listening and you're asking me to look at the future, I have to admit that there's a little part of me that goes, I'm sure this was talked about years ago. I'm sure these very conversations that we're having, perhaps even my own mom talked about at some point. And in that sense, it's sometimes tempting to get very discouraged, because when is it going to change? The issues didn't really change. It's just we're still so slow to embrace the change. But then again, I look at my mom and then I go, okay, things have changed, right? I mean, in my little world, when I was training in med school, there was a quota, I have to say, against women. Literally, they did not allow more than 1 in 5 to be women. And why? Because because we've got socialized medicine, we've got very good subsidies for med school. So investing in us may turn out to be a waste, because then we end up having kids and leaving the profession. I mean, I
cannot think of a more demoralizing message to women out there, right?
Exactly. Yeah. And so, well, we started there. But guess what? Now, even in our own med school in Singapore, it's at least half are women. That there's no quota. And now I see quotas on grants that say, actually, you must have at least this amount of women included now. So the quotas work the other way around now. So you know what? I have to tell myself things have improved. Okay, maybe not as quickly as I would love, but things have improved. I'm eager for the day when it's just equitable, that we really just have the best people leading trials and in leadership. And that doesn't matter which gender, which, I don't know, ethnicity, where you come from, but just purely based on what value we can all bring together. I mean, of course, that would look really nice. We are edging towards it, and let's just not lose heart, I think is what I'm saying, even as we kind of edge step by step towards it.
Yeah, I love today's discussion, and I want to thank both of you for participating. I think we can all agree that our joint mission is to accelerate this path to this runway and make sure that we can have not just a lot of productive discussions, but actually tools and resources that all of us can implement, even within our local institutions, groups at our place of work, to help and elevate other women. And I know that Medscape is dedicated to that mission. And so I want to thank both of you for participating. I want to thank everybody who tuned in today. And please stay tuned for the next episode of our Women Leadership series coming up soon. Thank you both.
Thank you.
Thanks for joining us. Tune in next week as we continue our journey to amplify the voices of women leaders in pharma and medicine. Hear from Her is brought to you by Medscape Education. Please subscribe to hear from her on your preferred podcast channel and follow us on LinkedIn. Until next week, remember to lift as you rise.